Good morning. Isn't this nice? We've actually got human beings in the room with us today, and thank you to those who are joining remotely as well. And a pleasure to have you here today. Also a pleasure to have with me today the recent recipient of Manitoba's Order of the Buffalo Hunt, Dr. Brent Roussin. Brent, thank you so much for all your work, and to your team, of course, thank you as well. I've said it before, and I'm going to say it again, and we'll keep saying it until everybody does it. Vaccines are our safest and only way out of this pandemic. Vaccines are our protection against the fourth wave. Vaccines are our protection against future lockdowns. Vaccines are how we get our lives back. And I want to commend the hundreds of thousands of Manitobans who've participated in our truly historic vaccination efforts thus far. Thank you to you for your willingness to do your part. Roll up your sleeve not once but twice and protect yourself and protect your fellow Manitobans. Protect our businesses too, our small business community. Protect our economy. And to protect our communities and our healthcare system as well. To date, we've had nearly 2 million vaccinations, 1.9 plus administered in Manitoba. More than 81% of Manitobans have received at least one dose. Almost 76% of Manitobans are fully vaccinated. And a few months ago, Brent, I think we would have hoped that that would have put us in a state of protection and safety, but such is not the case with the new and emerging variant threats that we have to face. It's a significant accomplishment. We are leading the country, and Manitobans deserve to be very proud of their collective efforts, but there is more work to do, and it is this work that we want to address today with some of our comments. We have to understand that Manitoba is not an island. We understand right now that the COVID numbers here are very low compared to most other jurisdictions in Canada. But we've seen this before, and we are watching case counts climb in other jurisdictions around us, and we are hearing projections that are dire. Experts are saying that the fourth wave will be an even greater threat in terms of its numbers of cases than the third. We've seen this pattern before. In a general sense, Manitoba has delayed the onset of each wave, but when it has come, it has hit us intensely. And so we want to avoid a repeat. We don't need to see this rerun again. We need to get to higher ground to avoid the tsunami. And as we prepare for the fourth wave of the pandemic in the new school year, it is critical that we do everything we can to get all Manitobans who are eligible fully vaccinated and protect those who cannot get vaccinated as well, such as our young people. This is why today we're announcing that all frontline provincial employees who work with vulnerable populations must be fully immunized by October the 31st or undergo frequent COVID-19 testing. This includes healthcare providers, educational and early learning and childcare providers, public servants and agencies who work in high-risk settings, and Manitoba justice officials who work with vulnerable people and in correctional facilities. As a government, it is our expectation to lead by example. We will require all government staff in the Manitoba Legislative Assembly to follow these policies. That will include MLAs. All designated public sector workers will be required to be fully immunized and provide proof of vaccination or undergo frequent COVID-19 testing in order to ensure the safety of their workplace and the people they serve. It should go without saying, but I will say anyway, these employees work directly with and for the people of Manitoba, and there is nothing more important than protecting the safety of the people of Manitoba and the security of our communities. As an additional protection measure against the rising Delta variant and a possible fourth wave, we are also announcing today that we are requiring mandatory mask use in all indoor public places. As well, later this week, details will be provided on the expansion of the list of activities, services, and places that will only be accessible if individuals are fully vaccinated. In other words, we're strengthening the value of being vaccinated and the utility of the VaxPass in our province. Discussions are underway. Dr. Roussin will be sharing the updated details of this information later this week, before the end of this week. With that, I'll pass it over to you, Brent, and Dr. Roussin will provide more information to us.
Well, thank you, Premier. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer, and so just to start, I want to extend my thanks to you, Mr. Premier, throughout this pandemic for working with public health and listening to public health advice and to enact measures that are there to really protect the health of Manitobans. So appreciate working with us on that. Public health has been advising Manitobans for many months now on the value of being vaccinated. It's the best way to protect yourself, those around you, and our province. We've also been advising Manitobans that the Delta variant poses a threat to us, and certainly can see now that a fourth wave is inevitable here in Manitoba. What isn't inevitable is what that fourth wave could look like. We do have 75% of eligible Manitobans have received their first and second doses. So again, this has been quite an achievement for Manitobans and for the Vaccine Implementation Task Force. So quite encouraging, but unfortunately with Delta, it doesn't go far enough. Our vaccine rate is not rising quickly enough. The increased transmission of Delta variant we can see can lead to a rapid rise in cases, which again puts stresses on the healthcare system and critical care capacity. So this healthcare system strain doesn't only affect those with COVID, it affects all Manitobans. Manitobans requiring other type of healthcare. So it's in our best interest to keep these COVID numbers down. And the best way for that is for us to practice fundamentals, which includes being vaccinated as soon as you're eligible. We know that if our healthcare system goes over capacity, we're at risk of needing to find critical care capacity again elsewhere, including outside of the province. So we need to do whatever we can to limit the chances of that. So today's announcement, these new public health orders comes in response to these increasing concerns with the fourth wave projections, what we're seeing in other jurisdictions around our nation and other nations. So the new public health order will require all provincial employees who work with vulnerable populations to be fully immunized with 2 doses of COVID-19 by the end of October or undergo regular testing. So mandatory immunization requirements for all provincial employees and public servants who have ongoing contact with the vulnerable populations, which include direct healthcare providers and workers, including but not limited to physicians, nurses, allied health professionals, support services staff, and others. Education workers, including teachers, school and educational support staff, bus drivers, and custodial staff. Early childhood education workers, including staff and practicum students, public servants and funded agency employees who work in congregate residential settings or work with vulnerable populations, enter the home of clients or visit sites with vaccine mandates, and Manitoba Justice employees who work with vulnerable people and in correctional facilities. The order does not require vaccination as a condition of employment, but rather employees will have a choice between being fully vaccinated and providing proof of that vaccination status or undergoing frequent COVID-19 testing in order to work. So those designated employees who are not fully immunized or who cannot provide proof of vaccination must submit to COVID-19 testing regularly. And so for a full-time employee, this could be up to 3 times per week. And along with that, a negative test result is required. So all affected staff will be required to be fully immunized with 2 doses of COVID-19 by October 31. Remember that to be fully immunized, you must receive 2 doses of the vaccine and 2 weeks have passed. So that means people who haven't received a dose yet need to do so as soon as possible. We need to wait that 28 days before the second dose, plus you need 2 more weeks after receiving your second dose to be considered fully vaccinated. So we've seen the effects of lockdowns and school closures on people across Manitoba, and we know this has significant negative effects, especially on our children. Our kids are heading back to class soon, and this mandatory vaccination requirement is just another layer of protection to ensure we can keep our kids back in school and keep them there safely. Educators want their classrooms to be safe as possible. And parents are placing their confidence in schools to keep their children safe while they learn. And so by requiring these individuals who are working with vulnerable populations to get immunized and continue to follow the fundamentals, we can protect those most at risk of COVID-19 as the Delta variant is approaching us, and really to avoid a full lockdown. In previous waves, really the lockdown, the intense public health restrictions were really our only tool. Now we have a much better tool, and that's vaccination. So with increases in our vaccine uptake, we can do whatever we can to avoid further lockdowns. So we believe that this public health order will align with and support Manitoba's priority to provide immunization opportunities to every eligible Manitoban. So Manitoba Public Service staff will have until September 7 to get a first dose, and then by mid-October to get that second dose, so they have 2 weeks past their second dose to be fully immunized by October 31. So people are strongly encouraged to book appointments as soon as possible. We're recommending that private businesses and organizations follow the province's lead and consider mandating COVID-19 vaccination for their employees to protect their staff, protect their customers. This will reduce the chances of outbreaks in the workplace setting, which we've seen many examples of in previous waves. Public health is still requiring businesses to report cases. And public health will still be considering the temporary closure of businesses that have outbreaks in them. So we really suggest that you do what you can to have very high vaccine uptake in your places of business to avoid such issues. We're also bringing back the mandatory mask the mandate for indoor public spaces. In addition, we'll be releasing an updated list of facilities, events, and services that will require persons that are attending to be fully immunized, and we'll be doing that in the coming days. So our case counts are remaining stable for the time being, but we can see what's happening in other jurisdictions. We know that fourth wave is heading in our direction, and vaccine uptake, the vaccine credentials, the fundamentals are our best way to limit the impact of that fourth wave. Some more details and the complete public health order will be released as decisions are finalized, but I encourage all Manitobans who have not yet done so, book those vaccine appointments. And again, by requiring the people working with vulnerable populations to get immunized, wear masks, and expand that use of the vaccine passports, we can protect those most vulnerable of COVID-19. And what we can see in other jurisdictions that this is now a pandemic largely of the unvaccinated. And we have to make sure that does not lead to adverse health effects for all Manitobans. We want to protect all Manitobans from the fourth wave. So again, by working together, practicing those fundamentals and getting vaccinated, it's our best way to decrease the effect of this fourth wave in Manitoba. So thanks to all Manitobans, and I'm going to turn this back to the Premier.
Thanks very much, Dr. Roussin. I should mention also that I was honored earlier today also to present the Order of the Buffalo Hunt to Lynette Siragusa, our head of nursing and thank her and her team as well for their tremendous work throughout this pandemic, which is not over, which is ongoing. And to them and their families, to Dr. Roussin and Lynette, to their families particularly, who've taken on such onerous responsibilities. I know when they took them on, they didn't know they'd be this onerous, but we thank you for taking them on during this especially challenging time in Manitoba's history and Canada's history. We believe very strongly that this is the best way to protect our children, protect those who are vulnerable in our province, who cannot protect themselves. This is the best way to protect our business community and our economy, to protect our communities. We led the country when we created a secure Manitoba Vax card. Other jurisdictions, BC followed us yesterday in their announcement. Quebec has followed us earlier because we believe that the added benefit to those who have done their best by rolling up their sleeve not once but twice to get a vaccine is a good thing to be rewarded. And we want to make sure that we continue to have those vax numbers rise, but we want them to rise faster than they've been doing lately. Our Vax card's giving every immunized Manitoban the right to travel safely across Canada, and it'll now be your passport to doing even more, and that'll be announced later this week. And we have, with our community initiatives, our promotions, our incentivization through things like the scholarships for youth that were reported on yesterday, I think, we've endeavored to encourage folks to go and get vaccinated, and we are supporting every opportunity to give every Manitoban the chance to roll up their sleeve not once but twice, because that is what we need everyone to do. So I would say also that to all of those who have done this, who have gone and got vaccinated, remember the influence you have around you. Remember the people that are your friends and your family may not have made that choice, and you have the opportunity to encourage them, to educate, to inform, and to motivate, and that grassroots struggle is going to continue to help us. Please undertake to do that in your area of influence. Doing your part to get vaccinated and to encourage others to do it is how we're going to get through this together. Thank you. Look forward to your questions.
This is about protecting the younger population who cannot yet be vaccinated. Why not require that students who don't have a choice to attend public school also have to be vaccinated to go to school this fall?
You know, so we considered all possibilities where we want to mandate vaccines, or the testing. As of right now, we've seen the adverse effects of being out of school on children, and so as of right now, we are strongly recommending that all the eligible children be vaccinated. Right now, we're not making that a mandate, but if we see widespread community transmission, if we see outbreaks in schools, we need to continue to revisit that.
BC announced yesterday extended privileges for people that are fully vaccinated following Manitoba's footsteps. They went quite far with where you can go if you're fully vaccinated. How far are we extending privileges for people? Where is this going to extend to?
Well, I'll just say Brent's going to announce more detail here. We're in discussion right now with a number of interested stakeholders. Obviously, this has an impact on everybody, and so it's important to do that outreach, and we have been doing that throughout the pandemic. We'll continue to. So the details will be announced, I think, Thursday or Friday of this week on that. But it would be my view that it makes sense to motivate people and encourage people and reward people when they have taken the steps they need to protect themselves. They're protecting others too.
When would all of this become effective as well? What's the date for that public health order that we're looking at?
So as far as the order on expanding the vaccine passport use and the mandatory masks, we'll have more details on that later this week on when that will come in.
Any sense of how many teachers, healthcare providers so far have received the vaccine, and how many more want to receive it at this point?
So it's a really challenging number to come up with, because we don't have mandatory reporting up until going forward. So we don't have definite answers to that. We know that we have 80% overall of eligible people with at least that one dose, and so it's likely that that's in and around that number. But we'll be getting more and more information on that as time progresses.
Why still allow the option for testing and not just actually mandate it?
No jurisdiction, and I'm aware of, that has made mandatory vaccine a condition of employment in government or private sector. But we are obviously strongly encouraging those vaccines and to be pursued by everyone as the best way to get through this thing. We have taken steps throughout this pandemic to move arguably faster in terms of restrictions than other jurisdictions in advance of the situation worsening. Here in Manitoba right now, I just got the updated numbers on weekly cases, and I don't know if this graph's going to work very well here, but I'll just say the darker the shade of blue, the worse your situation you're in. Manitoba is an island. Okay, so our case numbers up to date, average rate of case per 100,000 is 17. Saskatchewan is 92. We're not taking that as a victory lap. We're taking this as an indication we're not an island. We've seen this movie before. We don't want to see it again. We were ahead of most other jurisdictions. We delayed the onset of COVID and the second wave and the third wave more than most other jurisdictions, but we got hit harder than everybody else, in part, I suppose, because of the delay. We need to take action now, and this is preemptive, yes, but it's cautious, but it needs to be done. Just to carry on, 92 Saskatchewan, 17 Manitoba, 105 Alberta, 17 Manitoba, 80 BC, 17 Manitoba, and those numbers in our neighboring 3 provinces to the west have shot up in the last month. So we're seeing what's happening in other jurisdictions. Ontario at 28 right now, but again, the numbers are accelerating, 36 in Quebec and higher in the territory. So just to give that indication, on any graph that looks at case numbers, and if you take a look at every province's graphs right now, you will see a significant uptick to the right on that graph in terms of case numbers. The only place you don't is Manitoba. That doesn't mean it's going to stay down. And I'm saying, and we're saying today, we know that it's going to come up. It's just a question of can we keep that thing from being as steep as it was in 2 and 3. And sorry, just to finish, Maggie, and then we'll take questions. But the projections are what are really hitting me, I have to say. And you're going to see the modeling here later today on where our experts are showing us. BC's projecting up to 10,000 cases a day within weeks. 10,000 cases a day, I repeat. Ontario, 7,000 by mid-October. That's their projection. Just to put that in comparative terms, their highest weekly average peak so far was 4,700. We're talking 7,000 on 4th wave. I'm saying this not to frighten, I hope, but to motivate and encourage all Manitobans to pursue getting vaccinated. That's the way out of this. That's the best protection we have. And we need people to pursue that. Saskatchewan has hit their highest COVID hospitalizations since first half of June. Alberta, the daily number of new infections is up tenfold since July. Modeling projections have Alberta at 4,000 cases daily. Okay, so that's where we're at. We're in a serious situation. We're taking preemptive action because we want to avoid the magnitude of what we saw in that 3rd and 2nd wave. All of us should work to make sure that we achieve that.
Dr. Roussin, are you...
Sorry, Sean, because I cut Maggie off before.
For the people who have medical accommodations, will they still need to get tested 3 times a week?
Yes, those who are not fully vaccinated need to undergo regular testing.
And who will be footing the bill for that testing? Is that an individual cost?
So remember what we're after here is to get as many people vaccinated, not as many people going through testing. So and then we have some time right now to work on those implementation type things on the exact nature of the test we're going to use, how it's going to be administered and followed. So really what we want to do is get as many people vaccinated as quickly as possible. When if there are people who are choosing to be tested instead, we're going to have more details on the operation of that upcoming.
But you're comfortable that you're talking about thousands and thousands of people to be needed to be tested every week, up to three times a week. Are you confident that you can meet that kind of demand?
So again, our goal is to limit the amount of people who actually will require that. I think being tested 3 times a week, seeing the nature of this Delta variant's going to encourage a lot of Manitobans to get vaccinated. But yes, as we work on implementing this, we're going to have to ensure we have enough of the appropriate tests to undergo this type of testing.
And mask mandate, when does that go into effect?
Again, we don't have the specific date on that. That's going to be announced in the upcoming days on when that will be in effect, and it will be shortly.
What changed in the past 3 weeks for the mask mandate? Because you guys were pretty confident that you could lift it 3 weeks ago and did.
Yeah, I think really we always knew that the Delta variant was putting us at risk. And we hit our vaccine targets. Numbers are very low, so we were confident with, at that time, the lifting the restrictions were appropriate for our level of risk. But what you can just see happening around us in Canada, it's just clear that we're going to get ahead of this now. So let's get the masks back in now. Let's get this increased use of the vaccine passport in effect now, so that we can do whatever we can to limit the effects of this pending 4th wave.
Two other quick things on top of that. I think the vaccine uptake numbers that had been going up relatively steadily have stalled, let's be honest. So we need to get back at it. We need to, it gets harder, it gets harder as you get closer to your goal, right? It's same with fitness or business goals. It's good progress, and then it gets harder.
What help is there going to be for businesses that are going to have to be dealing with immunization cards? We saw restaurants that had issues with it this summer, being said that they were the ones having to enforce this. We don't know where exactly it's going to be, but again, is the onus going to be on businesses to enforce this?
Yeah. Absolutely right. And you know what? We're talking to the restaurants associations all the time. But you got a choice now. You can be open and have double vax, or you can be closed. So which one do you think you'd want? I mean, restaurant owners want to be open and offering service to their customers. You want to go to a restaurant and be safe there, right? So I think it's time to be frank about this. I mean, there are challenges, and our small business community has been supported, and we've been supportive of them throughout this entire pandemic. But our small business people are not of one mind. There's tens of thousands of people engaged in small business, and I think the preponderance of opinion is they'd prefer to be open rather than closed.
Premier, questions on another topic. Are you going to be, Premier, are you staying on until October 30th? And if so, are you altering the legislature schedule or legislative agenda?
You will be among the first to know.
You've said yesterday that you were assuming that you would be staying on for a few weeks.
I think the other thing that's motivating this announcement today is the knowledge that we're going to be waiting longer to get children vaccinated. To me, that's a very, very big motivation for what we're talking about today. We had hoped that we would have that under 12 group vaccinated. We had speculation earlier in the year that it would be by now, and then we were told October. Now, the projections we're hearing are not till the end of the year, possibly earlier in the next year.
To answer my question, though, if I understand correctly,
the same way all the time, so it won't change.
So you're not committed to staying on until October 30th?
I've been committed to elected public office for 3 decades, Steve, and I'll tell you when I'm leaving.
Dr. Roussin, are we going to be seeing changes regionally? I know you're still in discussions, but could we see some of the privileges for fully vaxxed different in regions that have lower vaccination rates to try to encourage some of that there, like we've seen in the Arm, Stanley, and Winkler? So,
we don't take any options, away from public health. So if we see increasing case counts in a region, then we're certainly going to consider whether we need to enhance restrictions or use of vaccine passports in that region. So you can see in some other jurisdictions where they're taking that focused geographic approach. So we certainly will need to consider that.
how much time do you give people? I mean, we've had vaccines for months now. We've seen really low uptake in some areas. How much longer do you give them with kids going back to school and all of these restrictions or privileges, I guess you should say, coming in other parts of the province?
Yeah, so I think we've, Manitobas have done well overall, right? So we've hit that, 75% doubly vaxxed. So I think we've been on the right path. You're right. There's some geographic areas and some other areas where we see lower uptake, and we're going to do whatever we can to encourage that uptake through messaging about the nature of Delta, and then through some incentives. We've had some incentives in place now, and we're going to extend that. Like we say, this is really going to be a fourth wave, very largely of the unvaccinated. And so those who are doing their part to get vaccinated, to protect themselves, the people around them, they're going to be able to do many more of the things that they miss as we move forward.
You mentioned that the
We're gonna jump to
indoor
the
mask
phone after
mandate
this,
is going
guys,
to be
okay?
changing. However, can you assure parents and teachers and school workers that the indoor mask mandate will be in place before back to school across the province?
We're going to go to phone questions now, and then we
Paul
can
will moderate.
come
Yeah,
back
and
to
then we'll come back.
come back to these folks. Yeah, good. It's nice to
Thank you.
see you all here.
Thank you, Premier. Thank you, Doctor. First up on the phone from the Brandon Sun, Colin.
Good morning. I guess it's afternoon now. When did public health and the provincial government first start getting the sense that the fourth wave could be this dangerous?
You know, it's a tough question. I think we've known about Delta for quite some time, so we've been aware of it. And so even though when we hit our original vaccine targets and we've significantly loosened a number of our restrictions, we didn't ignore what was going on. We knew that at some point it was very likely we were going to have to re-implement some form of restrictions, some form of mask mandate. So we now have very clearly confirmed what fourth waves are going to look like in other jurisdictions around Canada. So that's why we're preemptively getting ahead of things.
When the mask mandates were lifted, I saw a lot of comments on social media from people saying that they were never going to be wearing a mask again after this. How are you going to get people to buy into a mask mandate again?
Well, I mean, one is it's a public health order, so it's a requirement. So there can be repercussions for not wearing a mask in indoor public settings. And then as we move forward, we're going to see that more and more of the indoor public settings that we attend are going to be requiring proof of vaccination. So I think that we're going to do a very clear job today of showing the risks of Delta. I think that's already been shown very clearly in other jurisdictions. And so now we're moving at this point preemptively to reinstate the mask mandate amongst the increasing use of the vaccine credentials.
And we need to remember as well that as much as we wish that the pandemic was over, you can't wish it away or it'd be gone by now. So we have to remember that the efficacy of the vaccines is still a subject of research. We have read some studies that show that over a period of time that a double vax person who might have had 90% plus protection initially may see that protection erode somewhat. So it's wise with the pending threat of a fourth wave for us to remember to remain cautious through this period of time, because we aren't invulnerable. We could contract or give COVID without intending to, obviously, and that risk is real. So it's important to remember and prepare for the worst, hope for the best.
From CBC Radio Canada, Mohammed.
Hello, Premier. Hello, Dr. Roussin. My first question would be, what is your assessment of the community outreach immunization program in South Manitoba? Is there any places where it didn't work as expected?
So I think there's been a lot of work done with the vaccine task force in setting up the super sites and reaching many Manitobans very quickly, and then alongside of that with the outreach to communities that might be more vulnerable or might have more vaccine hesitancy. So again, we've seen a very a decline in the rate of vaccinations as we've gotten higher and higher, but that rate has not stopped, and that's all the hard work of the outreach teams. So we're going to continue to work on that and continue to show the the benefits of the vaccine. Very few people are very few of our cases are fully vaccinated. Even fewer are in the hospital, and almost none are in ICU. So we're going to continue to try to get as many Manitobans vaccinated as quickly as possible to really decrease the effects of this fourth wave.
Thank you. And I know that you say that you will give more details on passport vaccine later this week, but for vaccine card, there were some issues for people who don't have a Manitoba health card, newcomers, international students. Are you tackling this issue with passport vaccine in the future? Are you thinking of that?
So I think there's been work all along on that, so we're going to continue to try to work out those type of details.
From City News, Mark.
Good afternoon. Wondering, when we first started talking about vaccines, the idea of herd immunity was extended
You're going to have to repeat, Mark. Your signal has faded completely.
Relocating, sorry. Can you hear me now?
Yeah.
Check 1, 2, can you hear me now?
Go ahead.
Sorry, apologies there. Asking about herd immunity and if it's even possible given the vaccines diminishing in their efficacy over time and the way the Delta variant is infecting people. Could herd immunity even be possible right now?
Yeah, so a couple of things with herd immunity. So herd immunity at the very basic level is calculated by 1 minus the inverse of R naught, and so you can see that the larger the R naught, the much more percentage of the population need to be vaccinated. So Delta's R naught is much higher than certainly the wild strain and higher than Alpha. So that means that our the original projection of people that need to be vaccinated is increased. Again, those calculations of herd immunity assume even uptake throughout a population. So when you look that we have pockets of very low uptake, then it's very difficult to achieve herd immunity because you're going to still see transmission in those areas. So what we do know is that the more Manitobans that get vaccinated, the quicker, the less effect this fourth wave will have on us.
Thank you. Sorry if my phone was beeping in there. Also, just curious, sorry if you did answer this question, but the testing that will happen 3 times a week, is that nasal swabs? Is it a different form of rapid test? What kind of COVID testing are you thinking?
So this is, we've given a lot of notice to these individuals here, so we really want people to take this opportunity to get vaccinated as soon as possible. The details of how we implement it in all those different sectors will be coming out later.
And our final phone reporter this afternoon from CHVN, Taylor.
Hi, good afternoon. Dr. Roussin, are you anticipating gaps from healthcare workers who won't get vaccinated or tested? And if so, how many are you expecting, and how is the province going to compensate for that?
So we've, certainly worked with the healthcare sector closely on the various ramifications of this. I think overall this is one of the reasons why we haven't made vaccine just a requirement for employment, that you have the opportunity to be tested, because of course our healthcare system is going to be under strain, and so we need to ensure we have our healthcare workers in place. So we do want them to be vaccinated, but if not, then that testing is that option. So numbers like that to anticipate is very difficult to know, but we'll continue to follow that really closely.
Thanks. And in the third wave, a lot of Manitobans just stop following the health orders with the mentality of what they do doesn't matter. How is this going to be addressed with this upcoming fourth wave?
I think it's the, however we want to frame it, that pandemic fatigue is real, and that's why when public health recommends restrictions or mandates, they are there for a reason. So it's why we loosened our restrictions when we could in August. It's why we lifted the mask mandate at that time, because at that time the level of risk allowed for it. When we re-implement restrictions, it's for a reason, and we're facing this fourth wave, and you can see the effects of this fourth wave. That's early effects of this fourth wave in other jurisdictions, and that's coming to Manitoba. So we're doing this preemptively and for very clear reasons.
Thank you. We now return to our in-person reporters.
Are there any plans for booster shots, given the concerns over the efficacy with Delta in some of the vaccines?
So we are looking at that. We have a clinical specialty table that we work with consultants here, looking at if and when third dose boosters may be required, what the eligibility would be. And then, of course, we always want to hear from the National Advisory Committee on Immunization as well.
For the mask mandate in schools, is it going to be for all grades?
Yes.
And BC yesterday said that the privileges for those who are fully vaxxed would be in place till at least January. Do you have an idea of how long, or is this going to be kind of a two-week?
Yeah, I think it's hard to put a time frame to it. We're going to have to see what, how many Manitobans we get vaccinated, what our fourth wave looks like, how that translates into strains on the healthcare system. So we won't put an end stop to it. But what we can say is that this is meant to be temporary. This is a temporary measure for an extreme circumstance.
Dr. Roussin, are you satisfied from what you've seen in health of the resiliency in the ICU departments across the province to manage a fourth wave? Because you alluded to it earlier, sending people out of the province. I think I heard you say that it's a possibility, but you don't want to see it again. I would suggest you had 18 months to get resiliency in ICU. If we don't get it, what's gone wrong? So anyway, have you seen that resiliency built up?
Well, when we talk about, if you frame it as resiliency, then I don't have any concerns, because the people who are working there have been quite resilient, gone through quite a bit. If you're talking about capacity, then it's about staffing. It's about people that are required to staff, nurses and other people working there, and so that's very challenging to largely increase, over time. So there has been inroads in that. This question is probably better to Shared Health. They can have better details, but capacity has increased over time. But yeah, it is a challenge when we look at the strains that they've seen over the past waves and the challenges they faced.
And let's be clear, we built additional capacity. Before this pandemic, there are additional ICU beds available that were fully staffed and equipped, as opposed to ICU beds in theory that were not fully staffed, nor were they fully equipped prior to our government coming in. So we increased the capacity in ICU. I don't think anybody anticipated that the pandemic would create the additional spike in demand that it did, and with the intensity that it did. That being said, our teams have been on an ongoing basis, have been doing everything they can to respond, and I think favorably. The people who've had treatment in our facilities, I think, are generally very, very complimentary of the care they've been receiving.
I think one of you gentlemen said this is going to be a wave of the unvaccinated, if I'm not mistaken. And I don't know about your travels, but the unvaccinated and who's left over that hasn't had their shots now seem to me to be among the most determined that this is not what they want to do, that 10+% of adults out there. Have you shifted gear in any way, shape, or form, or come up with a new message, or do you have something further to say to those people that appear to just they don't care what you say?
Well, we've used ongoing innovative approaches. I mean, we're the first province to introduce the Vax card, the Vax pass, to offer incentivization to people who are doubtful. Sure, there'll be a group. We've read various studies and polls. Leger did one that said something to the tune of 5% of people in the last poll I saw would never take a vaccination. But that number was much higher early in the pandemic. And that number itself is a dynamic number that's come down as people have seen or know of someone who's been infected by COVID. And when you experience that, you tend to change your tune. Sadly, that's been instructive to many people and has changed their view. Other things like the community outreach, where instead of Dr. Roussin and I trying to persuade people in various parts of the province to change their mind on COVID, someone in their neighborhood is talking to them, someone in their church or their community group is talking to them. There'll be a report coming out next week, I believe, on an update on those community outreach initiatives. They're working, you know, never as fast as I would like, but they're working. And so that and things like even the lottery, where people said, you know, I'm going because I'd like to have a shot at that lottery. Well, good. Whatever works for different people. Some people doesn't work for others. We're looking at dynamic ways, creative ways of persuasion. But the ultimate persuasion is this is just the right thing to do to protect yourself and others. And we need to continue to keep getting that message out to in a broad-based way.
Dr. Roussin, do you have the current R value for COVID here in Manitoba right now?
I don't have a recent one. We usually receive that value from the Public Health Agency of Canada that they calculate over time. So a couple of weeks ago we were at 0.6. You know, we're going to be closer to 1 right now.
Is it too early to say whether announcements like last week from the universities, colleges that are implementing vaccine mandates, if those are having an impact on our uptake?
I think it might be a little early. I haven't seen anything obvious on that, but what we're looking to see in the upcoming weeks is a significant increase in appointments booked. So we'll you know, hopefully be able to report on that.
And as our post-secondary minister said yesterday, we're working with the universities, post-secondary institutions, community colleges very closely and respecting that they are their governance rights are there and they're real. And so we're encouraging and supportive of what they're doing as well. We're partnering with them.
I'm going to try one more time on a different angle on this. You've said you said yesterday that that you're leaving the future of Bill 64 and other legislation to your successor. The legislature is coming back October 6th, or is scheduled to, unless that changes. Your successor is apparently only being chosen October 30th. So it sounds like you have to make a decision before October 6th. And
Well, that's not a question.
Well, what are you going to do about the start of the legislature and the legislative agenda?
Well, I'll continue to do the best I can, as I always have since I've been elected. I've been honored to serve the people of Manitoba and my constituency for a long time. So I'll just give it all I got as long as I can, and then when I decide to leave, I'll let you know.
And public hearing, second reading.
Not an easy decision.
Second reading on some of the bills is scheduled for the second sitting day after the resumption. And the resumption again is October 6th. That's on your watch, apparently.
Yeah, if I leave, I'll miss all that exciting work. That's right. That's what makes a decision hard.
Okay, thanks.
Anything else, guys? Are partially funded schools, independent schools, are they subject to the same vaccine requirements for staff?
I think you know, that would be, you know, public health would be recommending that. I think it would probably have be a question for education to know the details on that.
Thanks, everyone.
Thanks, everyone. Nice to see you in the flesh.